Welcome to this instructional video on how to take care of your braces. I'm your host, Dr. Swapp, and if you have any questions along the way, well, you just have to keep them to yourself because you can't ask me right now, but you can always call the office. You may be in the office right now and you can ask me right away and we can talk about any question you may have. But we'll get this party started and go over some of the steps and some of the crucial information you need to make sure your orthodontic treatment goes really well. I want to introduce you here to my friend Josh, and he did a really great job during treatment. He finished his treatment early, he took pretty good care of his teeth, and I asked him if he would help be my tooth model here today, and we're going to go over brushing. So the first thing I asked him to do was I asked him to eat a giant plate of Oreo cookies. So we had him go through a whole pack, just chomping them down. And then at the end, I want to show you what it looked like.
We want it to be like, put a little message in it. It's going to be extra long just for to make you suffer.
So after Josh had time to thoroughly embed all of those Oreos in every crevice of his braces and teeth, I asked him to go brush, and I said, brush your best, brush away everything you can. And I thought he did really great, but I want to show you how, even with all of that, how you could still miss. Now I went through and looked at every aspect of his teeth with this Explorer that you're seeing here, and you can see that, and to be fair, I didn't give him a chance to floss, and there were a lot of Oreos. But even with that, you can see how there's a few areas where it's still hard to get to, even with really good brushing and spending time to make sure you get everything on the surface, sometimes in the deep grooves. Go over a technique that will help you get at least as good as Josh, potentially better depending on how much time and if you have time to floss and all of that. There are three main steps to brushing. The first one is that you have to brush along the gum line. The gum line is that area between your braces and essentially your gums up here. You're brushing right where your teeth and gums meet. There's two important factors when you do that. The first one, you have to brush softly. The second one is that just know that right under the lip is one of the harder areas to get to, especially when you're younger and your mouth still isn't full size. The second step is that you have to make sure to brush the tops of your braces. So you have to angle the toothbrush a certain way in order to get that spot brushed well. Now, a couple of tips for that one as well. I would recommend brushing one tooth at a time. Spend at least 4 seconds for each tooth. And then at the end of that brushing on the top of that braces, push the bristles down to push any food out. And I'm going to show a video of how this works. The third step is pretty much the same, except you're going to angle it underneath the braces. And you're going to brush, again, 4 seconds, 45-degree angle, push the bristles up underneath, one tooth at a time. And then in all of that, after you get around the braces, you just brush the rest of the teeth the same as you did before without braces. All right, so starting off, you're gonna brush along your gums. It's the area between your braces and your gums. You do that very softly. So if you look down right there, you can see how you get the bristles up, and it's a little hard to see around the hand. I'll switch hands there. So you're gonna brush up along your gums right there, and that's gonna get off most of the food that builds up there. And make sure, like I mentioned, go past the center of your teeth. The second step is you're going to brush the top of the braces. And see how it's like 45 degrees, like it's kind of angled onto the top of the braces? You want to make sure you do that, and you're going to brush each tooth 4 seconds at a time. So see how, brush that 4 seconds, and then I push the bristles down underneath the wire. I don't know if you can tell, but the bristles kind of went underneath the wire and underneath that blue elastic, what we call a power chain. So you brush it, and when you brush each tooth one at a time, you actually are brushing more teeth, but you're focusing on one at a time. So see how each time, 4 seconds, and this is sped up a little bit, and then I push down. 4 seconds, and then push down. Okay, keep doing that. We're going to speed it up a little bit so you have to see this whole thing. But boom, boom, boom. See, it wouldn't be nice if you could just brush that fast and you wouldn't have to spend the full amount of time. All right, so there's that part. And then step 3, same thing as I mentioned before. You're going to brush 4 seconds each tooth, pushing up between each one. So 4 seconds, push up. 4 seconds, push up. It's repetitive. All right, just in a second here, I want you to see, you can really see how the bristles will be underneath the wire. I think it's this part right here. Yep. So I'm gonna push up and see how they get under that part of the braces right there. That's what's gonna push all the food out and make sure your teeth stay really clean. Now for some of our younger patients, those big adult toothbrush head sizes, they're hard to fit in that area, especially right here in the front where your lips are, because there's not a lot of room between your teeth and the underneath of your lips. And so what I would recommend if you're struggling on getting the brush into that area is getting one of the small child toothbrushes. The head is much smaller, and you just think of it as maybe having two toothbrushes. One's gonna go above the gums and get into areas you can't get, and then if you still want to use the adult toothbrush in the other areas, you can do that. So as you can see from this video here, we use that green floss threader, and we use that, and you tie it, you just take the floss, you tie it to the end of the floss threader. It can be reused, and you take that and you'll slide it underneath the wire, and it helps you get into those tight spots. The hard part is you have to do that for each tooth. And so at first it can be quite challenging, but you'll get used to it, you'll be a pro, and it'll feel good once you're able to floss all of your teeth. Now you can see in Josh's teeth, everything looks nice and clean. I can't find anything with my dental instrument there, and he did a great job. So congratulations, Josh, congratulations. All right, we've gone over brushing, we've gone over flossing. I have one maybe slightly unpopular recommendation or request from all of you. So you're probably used to brushing twice a day, hopefully flossing at least once a day, but I need you to brush at least 3 times a day and floss at least 1 time a day. So what that involves is brushing after breakfast, after dinner, but the middle of the day is where a lot of people struggle. It'd be nice if you brushed right after lunch, but some of you might be at school or in other situations where it'd be difficult to brush. So what I'd recommend, as soon as you can, brush your teeth. If you're in school and you get home from school, brush immediately. Even if you're about to eat dinner, brush the old food off. You don't have to use toothpaste, you just have to use a toothbrush. Follow the steps that we just discussed, and then you can eat, and then you'd brush with toothpaste afterward. So 3 times a day, every day, and then floss at least 1 time a day. And that will keep your teeth really nice and really healthy. The rest of this video is going to discuss some of the issues you may have with your braces and some of the ways you can take care of them from home or also prevent them altogether. So the first one, as you can see, is what we call a poking wire. Especially in the beginning, the wires are very thin, they're able to slide around more, and as you bite, it causes even more sliding of that wire. So as it moves, it has the potential to start poking your cheek or poking your gums. And while here at Swapp Orthodontics, we're pretty much always available to help you out if there's any type of emergency, sometimes it's not convenient to come back all the way back to the office to get these repaired. So in a poking wire, one of the things you can do is you can take like maybe in a pencil or something and be able to push it back over to get rid of the pain as much. Sometimes that's not enough or you don't feel comfortable doing that. So another option is that you can take some wax, and we gave that into your kit. And what you do is you take it, take off a little chunk of it, you roll it around and make a ball of wax. So you see me kind of do my best here, roll it around. Okay, there we go. You make it about that big and then about the size of a pea, maybe a little bit smaller. And you have to get the area as dry as possible. So you swallow all the spit. I would even take a paper towel potentially and dry off the area if you can get to it. And then you're going to put it over that. And that works for poking wires or if you have braces that are also feel sharp. As your mouth's getting used to all this, the wax helps make it softer. And this wax, we know that you can throw it away. If you accidentally swallowed it, it's okay. You don't want to swallow a ton just because that's weird, but it's not gonna hurt you or anything. So you can see on this example right here, there's a little spot on the braces that's kind of a little bit sharper or pointier. And so you put it into a ball, just coat the whole thing in it, and it's gonna feel better. Another odd thing that may happen is that, especially in the beginning, your wire may seem like it's bent out of place. If you bite on something a little bit too hard and it catches it just right, it makes it bend down like you're seeing here below, where there's a big U there. So If you can grab anything, maybe some tweezers or anything, and you kind of push it back up, those initial wires, they're so thin they'll just bounce right back to how they were. And some of the thicker wires, that's not possible, and you'll just have to come and see us if you feel like it's causing a lot of pressure. All right, so this part we're gonna talk about the don'ts, like things that you should not eat. And I would find that most people don't listen to me. A lot of people probably eat whatever they want, but you increase the risk of breaking your braces so much more. And the more your braces break, the slower your treatment goes, and it makes it really hard, really hard to finish your treatment on time. In addition, it's not fun to come back to the orthodontist office so many times. Sometimes it's unavoidable, but there are certain things you can do to make sure you avoid it. So one is eating hard candy. So I had Josh here, we had him eat this sucker, and you'll kind of see what happens here after I kind of push on his teeth really hard, had him bite down. He broke off one of his braces. So that's what it'll kind of look like. Now, that is fine like that temporarily. Just call our office as soon as it happens, and then if your appointment can't be for a few days, know that everything will be okay. This one's even more than candy. One of the bigger things that can cause a lot of destruction to your braces is ice. If you're chewing on ice, there's a good chance you're gonna break off some of your braces. And you can see how he's just chomping on this ice, and you can see how the braces break. And some of this is a little bit staged, but you're gonna see how that brace just broke off like that. And so it'll start moving around, and again, those are the things that can delay your treatment. All right, even scarier than ice is rocks. If you chew on rocks, you're for sure gonna break off your braces. You probably will even break off your teeth. So I highly discourage rocks. You see? Broke off his braces. Okay, probably there's 3 things that I hear most common. When someone comes in and there are a lot of broken braces, more than just one, but they have a lot. Usually it's one of 3 things. One of them is mouth guards that I have pictured here. If you have someone that plays sports and they're sitting there just chewing on their mouth guard, they'll come in and a lot of braces are broken, and you can see even in Josh here, he bit down and it caused his gums to bleed right there just because it applies so much pressure. The second one is bottle caps or something similar to that. Anyone that chews on bottle caps or some sort of hard plastic will break off a ton of braces. And then the third one is somewhat similar, but pen caps. Chewing on pen caps or pens or pencils, anything that's like a hard plastic, it's gonna break off. And so make sure out of everything you don't do, please do not chew on those 3 things. So my parting words for you after all of that was congratulations on getting your braces. If you've already had braces with us for some time and you're just re-watching this video, I hope everything is going well, and don't ever hesitate to call us if you need anything. If anything is bothering you, have any questions, just give us a call and we'll do everything in our power to make sure you're comfortable and that your experience is awesome. I look forward to seeing you at your next appointment. Have a great day.